And in Asia, there are no dispensaries like the places that you're working with. Obviously, we have CBD products in certain countries here, but we don't have the right knowledge of how much we should be dosing on this or the right way to take them. Could you take us through the way that we should be consuming these products?
Yeah. As a pharmacist, it works like most other drugs. If you think about it, drugs are really, really similar. They're not. It's not like one drug comes out and all of a sudden it's completely dosed differently than every other drug on the planet. It's pretty much the same type of a system. And I actually am on Twitter at Colleen Higgy, where I have links to a lot of Canadian doctors. And they're constantly using it within the healthcare system there and putting up on Twitter when they find the right doses of things. But the premise is still the same. You start low with the dosing. With CBD, we're finding that a good starting dose is generally about 10 milligrams of CBD. But what I've noticed is that most patients underdose. So if I ask them, hey, how's CBD going for you? It's all right, but it's not much out of it. You do need to dose it more frequently than just once a day. And with CBD, you're looking for the sweet spot. So there's a bell curve where too little isn't effective, too much isn't effective, and you're looking for that sweet spot. So you start by increasing it by, let's say we start at 10 milligrams every 6 to 8 to 12 hours, depending on the symptoms of the patient. We increase by, say, 10 milligrams per dose every 3 to 5 days, and then we let that settle in for a few days, and then we go up again. So you slowly and steadily go up. In terms of THC, the starting dose in the United States seems to be about 5 milligrams. If you were to go to any recreational dispensary, they're allowed to give out edibles and such in terms of a 5 milligram dose. For some patients, a smaller portion of patients that are sensitive to medications, I find that 2.5 or 2 milligrams is a perfect starting dose for them. When you combine CBD and THC together, the CBD mellows out that psychoactive feeling of the THC, so a lot of patients do prefer it. So you'll still get the relaxation and the pain relief and the anti-inflammatory action of THC, but the psychotropic feeling will be much more mild when you have it with CBD. But those are, as discussed in the book, those are generally the oral starting doses. In terms of inhalation, biggest mistake people make is think, I'll just puff. No. You want to take one small inhalation. Inhalation has its benefits in that it works extremely fast. Within minutes, you're feeling the relief. So for nausea or for anxiety or even for pain, it's a fantastic dosing system where you get a very fast and short-acting response, generally 1 to 3 hours. Oral dosing, where you're taking a certain measured dose of THC or CBD, generally takes about an hour to start working, sometimes a little longer, and then you have a 4 to 6 hour response. So the way you deliver the medication is also very important from just the dose itself.